I'm Candace Syriac, and I am an LICSW and the PHP coordinator at our PHP in Southbridge. So at the PHP, what we do is we're kind of like the middleman between somebody who's an outpatient and inpatient. So we're either trying to stabilize people and give them tools so that they don't go inpatient, or we are a step down so that folks can come down from inpatient to kind of come and make sure that their meds are right, give them more coping skills, and just maintain stabilization before we then typically refer people to outpatient therapy and psychiatry. We do offer at OBH outpatient therapy, psychiatry. We also have TMS. And then we also have a PHP for substance use, so they're dual diagnosis, as well as AIC to help folks with addiction issues to become more stable. So we are here today to just kind of put ourselves out there, outreach to the community, and make sure that people know that we're here. Talk about what we have to offer. We have some business cards. We have intake forms. Stuff about TMS and what TMS is for folks that are struggling with medication-resistant depression. We also have this awesome group that my colleague Craig is going to be running where it involves nature. And so a lot of his sessions are going to be outside, kayaking, and kind of like rehabilitation through the outdoors. So we have a lot of stuff that we have to offer here. Because it was back, I mean...
No, he's going to want to do better and pay you less.
It's okay. It ends up being hard.
It's actually
So we do a lot of search and rescue, missing kids, missing elderly, criminal apprehension, stuff like that. We can use it for fires, for the firefighter guys, for heat signatures, let them know where the strongest point of the fire is coming from. Just gives us, it makes up public safety safer for everybody, you know.
Yeah, and you have to get training for that.
Yeah, you have to get a FAA like pilot's license. It's called a Part 107. So it's kind of an extensive testing. It's all about like altitudes, longitude, latitude, kind of airspace. Let you know for like, obviously for like the helicopters, stuff like that, you know. So it's extensive. Definitely not an easy test.
Hi, I'm Jean Camo. I'm the nurse navigator for the lung screening program at UMass Memorial Harrington. And today we're here to talk about the Pink and Pearl Project. It's a project helping to promote women to not only get their mammograms every year, which most women are very good about, but also if they have a history of smoking, to get their lung screening. And Pink and Pearl comes from pink is the ribbon for breast cancer in October, and white is the ribbon for lung cancer screening in November. So pink and pearl. And as I said, we're here to try and encourage women because screening is what saves lives. Screening and able to detect cancers early is so vital to the community. As I said, most women are very good about getting their mammograms every year, but they're not as good about getting their lung screening. And lung cancer, unfortunately, kills more people than breast and colon combined. So it's very important that we have people screened. And what we do here at Harrington is try very hard to work with people and their providers, and we offer to do their test on the same day. So if they sign up to have a mammogram and a lung screening, we'll schedule them on the same day to make it easier for them. The other thing we have the opportunity to do is, because we're part of a large hospital system, is if they live in Southbridge and they work in Worcester, we can arrange for them to have their exams elsewhere within the system. So that's what we're here for, is to try to help people to get screened early to keep them healthy. So low-dose CT is low-dose CAT scan. So it's not the MRI, the tube that people always worry about with claustrophobia, but it's the CAT scan. It looks like a big donut. And the scan itself takes less than 5 minutes, and by low dose it means it's using a lower dose of radiation, which has proven successful in determining lung nodules. And that's what we're looking for, lung nodules. If we see a lung nodule, then the radiologist can determine by its size and shape and, you know, what a potential prognosis or what recommendations should be made. Is this someone who should come back in a year? Is it someone who should be set up for other diagnostic testings. And the radiologist can determine that by these CAT scans. Much the same as with a mammogram, the radiologist can read the mammogram and determine should this person be coming back for a diagnostic, or should they come back for screening every year. It's important for people to recognize that they should come for screening yearly, because things can fester. They can sit there and not show themselves for a long time, and then all of a sudden develop into something. So it's very important that we encourage people and make it as easy as possible for them to do screening of all kinds.
Now make a fist, right? And put your pinky right at that umbilicus. Now roll it forward towards you. Yep. So roll your pinky and then roll it like this, and then go like that. And it will pop right out. So really turn your fist. Your fist is here, and then put your thumb. Roll it like, and then
roll it that much.
Yeah, and then hold it with your other hand.
Oh! You got both of them. We did it! Yes! We helped him!
If somebody looks like they're choking, they often can't speak. They might sound wheezy or raspy, and often people put their hands up to their throat. So what you want to do is come behind them. You put the back of your hand over their belly button. You turn your fist over, so your thumb, and then you reach around and you push as hard. You pull as hard as you can, as many times as it takes. If they become unconscious, then you start CPR.
Hello, this is our outreach table here at Harrington. Today we are talking about just all the information that we have upcoming in the future. We are today showing all the information so everybody will know what's coming up in the future. Like as I said earlier, we have information on flu, we have information on stroke, we have information on our urgent care that is now in Oxford. We also have information on healthy habits, such as the difference between 5 pounds of fat and 5 pounds of lean. And then we're also showing kids and adults about the milk, the difference between whole milk, 2%, 1%, and fat-free. The yellow shows what's in the fat. And then we're also showing soda, which how it's not the best for you, and we show that when you drink so much a month that you will end up with like 5 pounds of sugar in your stomach. So other than that, we have some cereal here that we recommend that is good for you to eat, and other than that, I think we covered everything that we have at this table. So thank you.
I'd like to introduce myself. I'm Norm Meikle, Chief of Public Safety here at UMass Harrington in Southbridge and in Webster. The reason why we're here today is we provide training for our caregivers along with the hospital staff and the outreach of the community because of what we do at Harrington here and at Webster. We do a lot of programs. We do active shooter training. We do self-awareness, safe training for the nursing staff. We run the metal detector. Our officers are trained 300 hours before they're put on post to do training with the items that you'll see in the video of the potential that comes through the metal detector and is present on the floors or in the building. So that's basically why we're here, to demonstrate and show the caregivers and the community how active we are on safety at the hospital facilities.
Good morning. My name is April Parzik. I'm the Access Manager here at Harrington Healthcare, UMass. We have services we provide in Webster, Charlton, and Southbridge. Part of our patient access service job is to make sure that we get the right patient registered and identified the first time, that we make sure we collect the right insurance information so that you're billed accurately, and we also want to make sure that we provide you with the most optimal care and customer service that we can. Today we're here trying to encourage our patients to sign up for MyChart. MyChart is a way for you to get your results, and we can also link other facilities that also have Epic and MyChart so that you can get your results for other locations. So we encourage you to stop by the lobby at Charlton, Webster, or Southbridge and just say hello. And I want to introduce Beverly Jones. Beverly is one of our patient access representatives, and she will be here in the lobby to greet you when you come in for your registration services.
All All right. Kayla Kraus from the Center of Hope Foundation. I'm the Director of Marketing, and we're here today with one of our businesses, Scoops of Hope. So the Center of Hope serves individuals with disabilities, and one of the things we do is our vocational employment services program, and we have a lot of small businesses that employ our folks with disabilities, and Scoops of Hope is one of them. We're located at 54 Foster Street, and we actually make all our ice cream homemade. And we have 7 individuals with disabilities that work over there. So all of our shifts, you'll find somebody with a disability working. They do things like money management, cashing people out, scooping. They help with all of our flavor creations and whatnot. And we're here today. Harrington actually paid for all of the ice cream free today. Over the past 5 weeks, we had a flavor competition. 56 of their departments all submitted flavors. We created them, and we had People's Choice, Best of the Best, which one sold out first, most creative. So that's what you'd find here today. So we're here to promote our business and our agency, just be known in the community.